Global medicine and technology. Technology in medicine can help us in so many advanced ways. It is a human right to have access to treatment. If one part of the world has a cure to a disease or sickness, it needs to be distributed globally. Take a look at this list of medical devices. They are the most commonly used medical devices that store medicine to be transported globally. First, kerosene gas powered fridges. Second, solar powered fridges. And third, solar direct drives. This device keeps medicine cold in remote areas. Kerosene fridges are used in more than 60% of vaccine storage locations. Solar powered fridges contain thermostat temperature readers, which helps maintain the viability of medicine stored. And last but not least are solar direct drives. They use solar panels to directly freeze substances like water and other forms of liquid medicine. But the question still remains, how are these devices and medicine specifically being transported so that they reach third world countries? Well, let's take a look. It's all made possible with the World Health Organization, the World Intellectual Property Organization, and the World Trade Organization. All three organizations are working hand in hand to transport medicine and technological devices to low income countries, as well as other parts of the world. The World Health Organization also has a program with trained members that identify falsified products such as medicine and equipment that are being smuggled illegally. Smart, right? Let's take a closer look in an organization that's also been helping patients globally. The Bristol Myers Squibb is a nonprofit organization that donates medicine and equipment to patients globally.
等着两个医生嘛，跟我的话做胃镜嘛，他这个说肯定是胃炎了。
The Bristol Myers Squibb made it possible for Ma to enjoy farming again. The donation of medicine saved a life, and it can save many more too. In a country like eastern Uganda, X ray machines are failing during procedures. And as experts state, the X ray machine has been deemed essential to healthcare systems in the prevention, diagnosis, and treatment of illnesses and disease for all populations. Hence, the availability of medical devices have been proven to extend life expectancy all around. According to a New York Times article, experts found that there were only 11 ventilators supplying more than 20 million people at a hospital in Burkina Faso during the coronavirus. It is also reported that 10 other African countries had zero to no ventilators whatsoever. Now, there are countless advantages of transporting medical devices and medicine to third world countries. Here are a few. First, increased life expectancy. According to the Bergen Project, in 2011, the life expectancy between high and low income countries was as extreme as a 36-year gap. Secondly, medical devices can be used to prevent deaths to diseases that are easily cured. And last but not least, prevention of pandemics. Because when every part of the world has access to the same medications, diseases can be easily controlled. An example, COVID 19 vaccines were distributed to every continent and territory in the world. In recent years, and according to the World Health Organization, in low income countries, life expectancy is 18.1 years lower than in high income countries. One in every 14 children born in a low income country will die before their fifth birthday. Now, there are certain problems that arise when transporting certain medications or medical devices to other parts of the world. Effectiveness. Countries may not have the knowledge on how to use a certain equipment or administer certain medications. More learning time means a slower succession rate. Mechanism. Not all countries share the same outlet mechanism. Donating medical devices may be limited in this matter. In the US, the outlets are different from the outlets in countries like Kenya. Pricing. Funding can be uncertain. It can be quite difficult to raise the money to transport these devices and medicine globally. Patents. When new markets gain access to previously owned medicine, the cost of patents increases drastically. Thinking ahead, we need ways to permanently keep these medicines and equipment accessible at all times. An example is to install teaching programs to hospitals in these countries so the doctors are knowledgeable on their usages. Expand the countries in the Doctors Without Borders program past just 82 countries. And last but not least, speaking to local communities, asking them what they need and not just assuming. It also builds trust between the community members and the doctors, letting them know that someone cares, and it keeps them informed on the new opportunities. So, we've come to a conclusion. What have we learned? Medicine is essential for all. It is inherent to understand that knowledge that has been shared with you needs to cycle around to those that need it as well. If the COVID 19 vaccine were only made accessible where it was invented, we would still be struggling with the disease today, and it would most likely have gotten worse. Second, people care. It is unfortunately not as simple as it may seem, but amazingly enough, there are already people that care about this issue and have been working with other organizations to come up with solutions. And lastly, humanism deals with every human being, not just the ones adjacent to you. And so it is apparent we keep an open mind and work for the better of the entire species so that we all move forward together.